Most common methods of Iabp insertion. One is percutaneous insertion, in which we should puncture the needle in the pricked artery, then inserting the guide wire, removing the needle followed by vasodilator, using a sheet in obese patients, then inserting the balloon, which is deflated by a syringe upon to the manufacturer insertion kit. Then the second most common methods of Iabp insertion is femoral artery cut down is an insertion, in which the common femoral artery is dissected and vascular fascia is opened. Common femoral artery is isolated through a vertical groin insertion with a retractor. Femoral artery dissected up to the length of 5 cm on cotton tapes placed proximally and distally, then the insertion starts. And then the third most is transthoracic insertion, in which Iabp catheter introduced down the aorta in operative room situation, in which Iabp catheter placed antegrade down the thoracic aorta. Another is access routes. நம்ம எப்படி எந்தெந்த அக்சஸில் நம்ம ஐபிபி இன்செக்ஷன் நம்ம அப்ரோச் பண்ணலாம், அதுதான் ஆக்சஸ் ரூட்ஸு. ஃபஸ்ட்டு சைட்ஸு. எந்த சைட்ஸில் ஃபெமோரல் ஆர்டரி அப்ரோச். ஃபெமோரல் ஆர்டரி நார்மலாக நம்ம யூஸ் பண்ணுற அந்த ப்ரைமரி ஆக்சஸ் ரூட்ஸ். நெக்ஸ்ட்டு ascending aorta placement, that is due to for indicated for failure of bilateral femoral approach. And then subclavian artery placement எப்போனா severe atherosclerosis or some obstruction in the left subclavian. Likewise we can use a subclavian artery placement. And then axillary artery placement, it is indicated for in ischemic complications in the upper extremity. And then Iabp insertion techniques, these are the techniques we are using. The first is cut down technique, that is we done in femoral artery cut down insertion. Same is the cut down technique, that is where femoral pulse is not palpable. In obese patients there be femoral pulse, they can be not palpable or some peripheral artery disease. So for those peoples we can use the cut down in technique. And then percutaneous technique, that is cell insert technique we use in percutaneous insertion. Here this is same procedure of cell insert technique. And then sheathless technique, that is reduces the length of the catheter and the risk of limb ischemia. Sheathless technique, it is useful for those peoples, and also it is useful in limb ischemia. And then subclavian insertion to avoid aortoileostenosis, and brachial insertion in bilateral obstructive femoral artery, and transthoracic insertion in severe peripheral vascular disease.